Good afternoon, everybody, and welcome to Birchwood Surgery's third session now in Women's Health Month. And this one, we're focusing on endometriosis. And I've got the delight of Emma beside me here on the meeting, who is going to introduce herself, where she sits within an organisation. And then me and Emma are basically going to have a really informal chat about endometriosis and her journey. So I'll pass over to Emma, who'd like to introduce yourself, if you may, Emma.
Hi, I'm Emma Reeve and I'm one of the volunteers for Endometriosis UK, and I also co-run the support group under Endometriosis UK in Norwich.
Lovely, thank you. So I'm really delighted to have Emma with me today because I think, and Emma will probably agree with me here, and so will the society, that it's really important to get our understanding of endometriosis kind of out into the communities. I know when I've done my live sessions in the past, because I did my cytology one and I've done my contraception one, that there was some questions starting to emerge about endometriosis. Women wanted to get more information, and I think, Emma, obviously you get that, don't you, with questions and the support group that you run. So we'll start off with kind of like thinking about the condition endometriosis is kind of like, from your point of view, Emma, how do you explain that condition to women who might be on the end of your phone, or your own experience perhaps?
Before I got diagnosed, I'd never heard of endometriosis before, so I can completely understand how alien it is because of it. Our biggest thing is it's similar to the lining of the womb, but growing outside of the womb area. So it shreds every month, it bleeds but out of the womb, it's got nowhere. So that's where it can create scar tissues and start causing all the problems. And so that's where the pain comes through, and being stuck to other areas of the body and creating the fibrous tissues. So that's where endometriosis is. I describe it as a bit like candy floss. And a lot of people look at me quite weird with this, but it's when the sugars haven't dissolved properly. And that's when you get the fibrous things, and it's all sticky and it's sticking to everything.
I really like that analogy of candy floss. I'm going to probably use that one. If we're thinking about that candy floss sitting within our organs, then describe to me how, as a woman, that feels when you get the kind of the bleeding that you get associated with it, and the knock-on effect it has to the rest of your maybe bodily functions or organs, perhaps.
And so it depends on what part of the area of the body is, and everyone will experience different things. There's no one fits all. So if your symptoms don't match up to somebody that you know with endometriosis, it doesn't mean you don't have endometriosis. It just means you could be experiencing other symptoms of endometriosis. So it's a lot of pain around the pelvic area and the back area, especially on the build-up and around the period or ovulation. Painful periods that can stop you doing things. Periods shouldn't be painful. They should not hurt. But with endometriosis, we find that really does. Pain during and after sex, including bleeding after sex as well. Pain when opening your bowels or going to the toilet. Feeling sick, constipated, diarrhea, or blood in your urine or bowels around your period could be another one. And another symptom could be having trouble getting pregnant.
Okay, so just listening to you there's a whole list of scenarios and situations and problems that occur. So obviously we've touched on them by you mentioning them, and I might have ladies sitting out there in the moment in their audience thinking, well, I recognise some of those symptoms, and I wonder if maybe I have got that condition. And I think it's quite important you said that it's not the same for every woman. So if that's the case and they approach their general practice, I mean, how did your experience go when you approached your general practice?
I'd been having issues throughout years, and I'd gone to the doctors multiple times. I'd been put on different pills. I'd been told it was IBS. I was told to lose weight. That was the key one. Lose weight. Need to lose weight and things will help. And I just got told, I'm a woman. I've got painful periods. It wasn't until actually one day I woke up in excruciating pain. I ended up in A&E, and they thought I had appendicitis. And I ended up staying in for 5 days. They still didn't work out what was wrong with me then. I got discharged, and I ended up then going in for a laparoscopic operation 8 months later. And that's when I found out I had endometriosis. But I would say to anyone, if they think they could have endometriosis, to keep a pain diary. get your evidence, see if there's pictures of cycles going on. Endometriosis UK on their website has a template. Download it, fill it in. The more evidence you can take to them, the better it will be for yourselves. At the moment, on average, it takes 7 years to get diagnosed from first going to your GP to actually getting your diagnosis. And Endometriosis UK are trying really hard to bring that down at the moment. That is one of their key goals. And so, but by doing the pain diaries and stuff like that and requesting to get referred to gynae, it will really help with that as well.
Well, that's really useful because it's a lot of like, what do you take to your doctor? What do you give your doctor? So what I'll make sure is that we send that link to get that template so that ladies can start to really fill that diary in as a really good like history of what's going on in their system. And that shocks me, I think, sort of 7 years to kind of think to myself, oh, women are suffering and this is a length of time, isn't it? I mean, 7 years. And how do you feel? How did you feel in that 7 year or the time span that it took from you going to your doctor, obviously hospital admission and then diagnosis? Kind of, how did that make you feel?
It felt I was going crazy. I was like, why are people not believing that I'm in this amount of pain? Why am I not being taken seriously? Why am I being told it's IBS? I know it's not IBS because no treatment I was trying worked. And then I also got diagnosed with polycystic ovarian syndrome as well. So then it got put down to, oh, this is why you've got PCOS. I was like, but this shouldn't be like this. So I was very lucky from my hospital admission to getting diagnosed, my GP stuck by me through thick and thin. And he really supported and really advocated for me. So I was very lucky in that sense. But I've heard from lots of women that haven't had that same support as what I have. So I'm very conscious of that as well.
Okay, and that's quite important. Like say, you did have the support of that GP, and we know obviously in primary care we do help to support endometriosis through the use, like you touched on, like treatment pathways. So it'd be things like looking if we can use the combined pill to help support the bleeding, looking to see whether the use of a intrauterine device can be used to help to shrink down those endometrial plaques. So we do have treatment pathways that we can offer in primary care, but it is that sort of diagnosis and that long-term management which we're often looking for a woman so that they don't have
exactly
continue. Yeah, okay. So obviously for yourself, you got your diagnosis. What was the next steps after the diagnosis came for you?
I was then referred to the Norfolk and Norwich, what has a specialist endometriosis centre within it, so it has the multidiscipline team. And then I went on Zoladex injections, what puts you into an artificial menopause. And then I've actually had a full hysterectomy myself personally. I was offered different treatment plans, but the hysterectomy was the way I chose to go with my treatment. Okay,
so I think that's quite important, isn't it, that you've said there that you get individualised treatment plans. So you're right, at the North Korea, we're very lucky to have that specialist service where referrals can go through. Individualised treatment plan, treatment pathways, and you've touched on the fact that you had the Zoladex injections, for which I've got several of my ladies on those injections. And how long would you say you were kept on your Zoladex injections for, Emma?
I was on my Zoladex injections for 22 months from going on it to having my surgery. I actually had my surgery on the day of my 23rd injection.
Okay. And I know that I've got some ladies at the moment who are receiving those injections as part of their treatment pathway, and I may be feeling frustrated because I know the pandemic has created a delay in their treatment. I think it's quite refreshing to hear, in a sense, not nice for you, Emma, but the fact that yours did actually take 22 injections.
Yes.
And are you getting women coming through the support lines at the moment who are frustrated because of delays in treatment?
100%. I also was delayed as well with my treatment because of the pandemic as well. And I know I work very closely with the Norfolk and Norwich as well within the support group. And I know they are trying their absolute hardest at the moment to get that down as safely as they possibly can. But obviously they are limited to beds and everything like that. So they understand it, and they are looking at different ways on how they can try and bring it down the best they can. But I do understand with how much it can affect. I mean, towards the end, my Zoladex injections was not giving me any pain relief, and I will openly admit that. But I also knew that it was keeping my endometriosis under bay and trying to stop the growth. So that's why I carried on with it myself. But I know then other women that actually were like, no, I want to come off Zoladex as well. So it can vary. Everyone is different. Like I said, there is no one size fits all 100%. You do just have to be very open with your primary care, with your specialist and everything. If you are struggling, ask for help, seek the support from the specialist nurse, from your GP, from yourself. You know, there is lots of different support around for you. It could be actually a slight change in medication could help, or using a TEMS machine, using, you know, there's so many different supports, whether it be a bit of exercise as well, depending on what it is. Diet changes, that can also make a massive impact. There's so many different ways to explore, you know. I look at it as you can't just treat the symptoms, you have to treat the whole person. So you've also got to have the holistic approach as well, and the self-care.
Yeah, so exactly. So looking at that self-care and that holistic approach, is that something that ladies could sort of contact yourself as an organisation to get that sort of advice as where to go to look for those kind of support networks, that using of TENS machine, the dietary and the lifestyle changes? Is it something they can contact yourself for?
100%. We have monthly, we've actually just gone back to face-to-face meetings, what's absolutely incredible, instead of being online. So very excited about that. But we have coming up, hopefully in the not so distant future, we have got a dietitian coming in to do a talk for us, and that'll be specialist around endometriosis. Surgeons also come in and try and do chats for us as well about different upcoming things that they've got, or whether it could be endometriosis on the bladder and bowel. We've had also a partners welcome meeting as well, where we actually met in a local pub, and so the men could actually see they actually have got support out there as well, and it's not just the women, just so they knew that actually there are other men that are going through similar things, because watching your partner in pain is so hard. So the men and women, you know, of their partners are more than welcome to come and join in as well with us. So we will try and always support and give ideas how to do that. We're not medically trained. We don't pretend to be medically trained, but we will try and offer advice or signpost you in the correct direction to get that advice you need if needs be.
Oh, that's fantastic. And like I said, I can share that link with our viewers as well. And I think you've touched on some really important points for me there. It's like your partners as well. It's those family members supporting that person with endometriosis. It's the feeling of maybe them being helpless. They don't know what they're sitting back and watching you in pain. They can't do anything, can they?
No.
And you need their support, and they need somebody to support them. So the fact is in a pub. Well, for the viewers that know me know that I quite like a pub anyhow, so I think that would sound wonderful. I think it's quite important also. I think you've touched on some other things there where you said that it's the effect that the endometriosis can have. We talk about like the pelvic area, but it's also, you mentioned like bowel and bladder problems as well.
Yes.
So if you can kind of elaborate a bit, expand kind of for our viewers kind of what that might mean and entails from that point of view.
It could be that you're unable to empty your bladder properly, the overaction of your bladder, so the constant need. With the bowel, actually having diarrhea and not being able to control it properly, being constipated as well. Unfortunately, with endometriosis also normally comes opiate use. So that could then lead to constipation as well. So it's dealing with that. It's different areas of the time. I mean, myself personally, at one point, I couldn't fully empty my bladder, so I had to learn how to self-catheterize. So I would self-catheterize because of that. You know, it's within that multidiscipline team at the NNN, you have then the bladder nurses as well, so they can teach you how to self-catheterize should you need to, or advice on how this, you know, they work with urologists as well. The same with bowel, they can give you different medications to try and help. So there's lots of different things. You know, it can depend on if you've got endometriosis on the bowel as well, if it's, you know, it's just on the outside, or whether it's actually worked through into the muscular wall as well. And then that could be different things. You know, there is points where you will need a stoma bag for certain service users. And so again, it's getting that support in place for them, for the families and the person. So it's getting that ready for them. So that's what we try and do with Women Endometriosis UK, is to build that support bubble of people that understand what they're going through and experiencing. Because that's another thing we found with endometriosis as well. You lose a lot of your friendships very easily because you are so tired, because you can never know how you're going to feel that day. And a lot of people will just then stop texting you, stop inviting you out, because you can't go all the time. So we can then provide that support for them, of people that actually know, I feel rubbish today, I don't want to do anything today. And it's not because we're lazy, it's because we physically can't. And that's the difference.
Yeah, and that's a huge impact on your life, isn't it? I mean, thinking about that, you're talking about, we think about endometriosis as like a gynecological condition, but you've already said urology, you've talked about bowels, you've got gastro, you've got other bodily functions incorporated, and then you've just said, obviously, alongside that is that ability to not maybe continue with the lifestyle that you had, those friendship groups tailoring off, and then you start to maybe feel quite alone and isolated, and whom is that support network? And organisations like yourself, Endo UK, are where you can go to find like-minded people who understand what it's like to go through the journey of being diagnosed, treatment, the effect it has on the body, and support you in, hopefully, towards the end of that final operation, which hopefully will give you some better quality of life.
I think that is the thing, is as much as we all wish there was a cure for endometriosis, there isn't, unfortunately, at the moment. And even waiting for that surgery, you know, could be people that end up having 5-10 years where they have no problems at all, or never need any more surgery. But then there could be people that experience troubles again within a year. So it's then being there to support that person again for when they need it, and to know that we're there for them with that cycle. We're not just going to wait for that first operation, then go, oh, you're done now, see you later. It's there picking them up. Because also after the operation, it can feel so weird. It's like, well, how do I start living again? Because you've been so used to being in pain. So it's being there to help put them back together again afterwards, and to help bring the support around them, and, you know, to get them experiencing and being able to enjoy life again if they can.
Yeah, it sounds quite, doesn't it? It sounds a cruel disease and what it takes away. Great that there's organisations to support, and there is an outcome. There is an end result. It's just a journey that you've got to go on. And I think when we were talking just before we started the session, it was a bit like you were saying that it's quite important that we try and get an early diagnosis to help prevent some of these situations. And hopefully, with the awareness that we can create today, people will start going to their local practice with the diary that you've talked about to try and get maybe on that pathway for diagnosis. Because I suppose there's also not all the physical things that are happening, the psychological things that are happening. And obviously with a gynecological condition, there's always that thoughts patterns of like, what does my future hold? Maybe thinking about fertility. So do you get a lot of women thinking about fertility issues?
100% we do. And within our group, we do have a mixture of people that have had children and aren't able to have children. And we've got some women that are now looking at IVF, for example. We've got that. So that is another session that we are looking at, hopefully being able to run fairly soon. Unfortunately, COVID kind of put that on the back burner, but we're hoping to get that back up and running again fairly soon. But again, a lot of women don't realise they have endometriosis until they actually try to get pregnant, because they've been on the pill for so many years, what suppressed the symptoms. So it's when they actually come off the hormones that they actually realise there's an issue. I mean, I went on the pill at the age of 12. And so, you know, it's a lot of younger women, especially if they suffer with heavy periods, do go on from very early years. So it isn't until you come off there. So that's another thing, is I hope at some point primary care also does take it very seriously if they have younger women or teenage girls, shall we say, coming to them saying, I'm really suffering with heavy periods, you know, and could that actually be that first red flag going, actually this could be endometriosis? That is one thing I would love at some point to happen. Unfortunately, it doesn't at the moment. But that's another thing, you know, as it's now going to get taught in schools about endometriosis. So that is absolutely incredible that that is now getting put onto the teaching. And if more parents know about endometriosis, then hopefully that will raise awareness as well. So then we don't have so many women suffering with fertility issues because of endometriosis.
Yeah, it's really interesting, isn't it, to think about the generations that we teach our education to. And I know myself, I mean, I go into assemblies and support like menstruation discussions, and I know I see young girls, because I talk about going from puberty to postmenopause at the two ends of my spectrum, and how many young people, and we have to have that balance, don't we, that we know heavy menstrual bleeding it can be a normal, and it can be an abnormal, and it's that good clinical consultation, just making a mark in the notes that started on the pill at a certain age because of heavy menstrual bleeding, just to have those bells starting to ring, like you say. And I love the fact that you said, and I often say it to my patients, you don't know how fertile you are until you stop your contraceptive method. And so your fertility is questionable until the day you start trying. And we have this golden rule in the practice that you like try for a year without any kind of interventions. But we have to be, I think, mindful as clinicians about looking at their menstrual bleeding, the pain, all the things that you just mentioned that you noted, and do we need to action something sooner?
100%. No, I agree 100% with you. It can also run in families as well. So again, if you have got someone in your family with endometriosis, have them open discussions with the younger generation. So again, they are aware of endometriosis. I mean, like I said, I've had a full hysterectomy. I'm very fortunate. I do have a daughter of my own. She's 8 and she knows what endometriosis is in child appropriate language. And again, as she starts her periods, that will be talked about again. You know, that will constantly be, it's never been a closed away subject in our house. It's always been a very open subject. So if she wants to come and talk to me about it, she's welcome to. And I think that is the biggest thing, is as our generations have gone on, we are more open about talking about our menstrual cycles and our bodies and everything like that, and to encourage it as well. So that if a child is worried about something, that they are quite happy to go to their primary care or their parents or a teacher or someone that they trust, and to have that topic and not to shy away from it.
Yeah, I think that's important. And I know I certainly did a session not long ago and we were talking about period positivity. And it is that kind of like, come on, let's all talk about it. It's something we all need to be aware of. And you're right to place it into the hands of education, because they deal with our young people, for generations to talk about it, for primary care to be very open around, yes, come and see us with your menstrual problems. We're here, talk to us, to get those conversations going so you can get those red flags raised if we need to. Create awareness, which is so important. And what I do love to hear is the fact that, yes, we've painted this picture of endometriosis and what it causes, but if we can manage it, which we can manage it, we can diagnose it. And for you, like you said, you can have children with the condition. And then if you don't, then there's support with IVF. So we've got lots of different pathways we can take patients down, haven't we?
100%, yeah. And like I said, the support is there to support whatever way you're on. And, you know, we are very much at the start of every meeting, we will always open the meeting as well and say, if you want to share, feel free. If you don't want to share, that is also fine. That is no problems at all. You do with what you feel comfortable with. But it's a safe, confidential room where it doesn't then go out of the room afterwards.
Yeah, that's lovely. And then thinking back to sort of like your journey that you've been on, Emma, which I'm so grateful you've been able to share with us today. You obviously suggested you'd been down the treatment pathways, you'd self-managed your condition, and then obviously you did end up with the hysterectomy. Are you able to kind of explain to me how that felt for yourself, for a younger person to undergo hysterectomy, for maybe some viewers that might be facing with that kind of decision?
I looked at it as I was toying between either going in and having surgery to remove what endometriosis I was there, or to have the hysterectomy. Myself and my husband have talked about this since having my little girl, about whether we were going to have another child or not, and we both decided that our family was complete. We have He has 2 children as well. So we have 3 girls between us, and anyone that has girls can understand.
That's enough, is it?
That's enough. And so we'd already decided we weren't going to have any more children. And at that point, my endometriosis had consumed my life. I wasn't mum anymore. My little girl got so used to me being in bed, rolling around in pain. She knew that I couldn't be going on a bike ride with her, playing football with her, that kind of thing. So that's what led me to my hysterectomy. Was I'd waited so long to be a mum, but then I couldn't be a mum. And so that's why I chose personally to have a hysterectomy. And it was all done through keyhole. It was, the NNN team are absolutely fantastic. I couldn't fault them in the slightest, but you have to make that decision what's best for yourself and no one else. Don't go, oh, she had a hysterectomy, I'll go for a hysterectomy. If that doesn't feel right for you, then talk to your surgeon about it, and they will advise you what they feel is your best course of action. And if you don't agree with it, that's fine as well. You have to be happy. It's a permanent surgery at the end of the day.
Yeah. And I think that's quite right, isn't it? That is permanent. And there are other options, aren't they? Women have got those options, and it's having those discussions with your surgeon to get the right option for you. I think for you, Emma, you've obviously, from what I can hear, is you kind of balanced your quality of life against your condition and thought, actually, what I want out of life, the endometriosis is stopping me. So ultimately, a hysterectomy for you was the right decision. And now, how do you see your life now? How does your life feel to you now?
1,000 times better from where it was. Would I say I still have issues? I still have endometriosis related issues. I'm not going to lie. I wish I could turn around and say to you, I have no pain whatsoever and I've had no issues. I can't, I'm afraid. But it's one of them things. But from where I was to where I am now is 2 ends of the scale sort of thing. So I will take that any day. I'm on HRT, and I know I will be on HRT until the age of 50, and I'm happy with that. Again, that was something else I had to weigh up for myself. Was I prepared to take that medication that I would need after that hysterectomy as well? So again, that's something else to think about and discuss with. So, obviously, that can put you at a very slight higher risk of breast cancer. But again, that's talking to your surgeons about your family history as well. So, could that actually have something to do with it as well? So again, it's getting that whole picture of that person and not just the condition. It's looking at every aspect of it. So weighing up the quality of life, weighing up, could there be a better treatment plan option? Is this the correct way for them?
Yeah, I think, that's all important. That's what we aim to do, don't we? We aim for that patient care to be individualized to that person for what they need at that point in their life.
Precisely.
Like you say, it's looking at endometriosis as a gynecological condition, but the whole wraparound that happens with the condition as well. So I think today is obviously, for me, brought home quite a few factors from primary care. We need to listen to our patients. We need them to bring that information to us. We need to work with them to try and work out if that is the correct diagnosis, and support them on their pathway of treatment, managing and supporting their symptoms, whilst letting secondary care obviously plan their further long-term care. Is there anything that you, obviously we've gone through quite a journey with you. Is there anything that you think either I've missed talking to you from a clinical point of view, or that you really think are top tips that you want to say to our viewers, or anything that kind of common themes that come through your support networks or your support lines that you think we need to just expose a bit more?
I would say one of the big things is self-care, because when you have got a condition like endometriosis, it's very easy to focus just on that and lose yourself. And when you're in pain every single day as well, your mental health will take an impact as well. So it's checking in. It's the primary care also checking in on the mental health side of things, and not just the gynecological pain. The other thing is as well, I would also say, is the NICE guidelines for endometriosis and the use of opiates as well, because so many people don't realise they can get the correct pain medication that they could need. And they can get palmed off very easily and be like, oh no, you can't have that because you could get addicted. It's, yes, you can get addicted to them if you use them wrong. If you're using them correctly for the correct way and being correctly managed by the GP, then it can work. So it's getting that pain manageable so you can treat the condition and make the correct decisions when you need to, and not do it just to try and get rid of the pain.
Oh, that's key. I mean, and obviously from a clinical point of view, we all know about the NICE guidelines, the National Institute of Clinical Excellence. There are guidelines. So I think it's important that we educate and empower our patients that is what they need to be saying. Look, I know that you've got a set of guidelines that can support me in the use of pain relief. So please, can we look at that together and work with your clinician, because the outcome could be better for me than it is currently as a patient's point of view. And we as clinicians are aware of those guidelines. So please, as patients, use that knowledge that Emma's imparted on you, and hopefully that this session's maybe sort of increased your knowledge of why you need to go to your practice, and speak through those symptoms that you're getting, and to be listened to and state that correct guidance. So that, and then obviously, like you say, you've got yourself as a support network, haven't you, Emma? And
yes, we have.
Yeah, and it sounds really interesting what you've got coming up, because you've obviously listened to what's coming through your phone lines, like what support is needed, such as the lifestyle, the dietitian. So will they all be advertised on your web?
They'll be advertised on our on the Endometriosis UK under our own page as well. And also we do have a Facebook group as well, that a closed Facebook group. So you do have to register with Endometriosis UK to be able to join our Facebook group. But again, that's there for advice for people as well, so people can post if they're there, and we'll also post local events that are going on as well within that Facebook group. And then we try and meet once a month and now back face to face as well. What's lovely. Yay. And so yeah, that's really nice to just be able to be there and go, do you know what, I need you girls, I need help here, and I need a bit of support, and just to encourage each other and be like, we're here for you, we hear you. That's the biggest thing, is hearing what people are saying. So again, we'll ask people what things would they like to see within our support group. So they'll say, I'd really like a dietitian, or I'd really like a fitness instructor to come in and give us ideas on how we can exercise, but won't aggravate as well, because it is an inflammatory disease. And so it's trying to get that difference right as well.
Yeah, and I think that's important, isn't it? Because so in primary care, there's so much we can do, but it's so nice to think that we've got this whole support structure that's out there for our ladies, which can tap into really what they need. And yours is all sort of bespoke and tailored to their needs and conditions as patients. So I think our viewers will really identify with that need for really specific for them. And the great thing that you've got your Facebook option, you've got face-to-face, which everybody wants to get back to face-to-face. 18 months not doing it. It's just like, I'd love to sit in a room with you right now, Emma, but this is the purpose of today. But you've got face-to-face views, you've got that looking after each other as a community to support it with a condition that is a lifelong condition. But we've talked about the treatments, we've talked about the pathways, we've talked about the support, and I just want to say thank you, because that's what our viewers really wanted to hear. And
thank you.
You should be very proud of the fact that you can openly discuss all of that condition with us for our viewers' point of view and empower them.
Well, if you look at it as 1 in 10 women, they reckon have endometriosis. That is the same as diabetes, 1 in 10.
Yeah.
And you look at how much awareness diabetes has around it compared to how much endometriosis has around it. And that's why we're going to fight for it 100%.
I'll certainly let our viewers listen to the session today. I have got a question and answer session, which is the following week, which there may be from this conversation some more questions. So you might find me, Emma, sending you some messages.
That's absolutely fine. I look forward to them.
I'll make sure I get all the links from you so I can put them out for our viewers as well. And I just want to say thank you very much for allowing you to explain your story for us. And I'm sure
thank you, Donna.
Certainly feel very empowered. So thank you very much indeed. I will sign off from this session to our viewers and listen in on the questions and answers that are coming forward for the week after. So thank you all for giving up your lunch today, listening to this, or for those of you who are watching it later on. Hope you found it really valuable. And thank you, Emma.
Thank you.